Thank you for joining us for this COVID-19 telephone town hall. If you'd like to ask a question, simply hit *3 on your phone, and an operator will come and take your question. If you're listening online, you can type your question into the question box on our website. We are just beginning to dial out to households across Arapahoe County, and we want to give folks a moment to join the call. Hi, my name is Erica, and I'll be your host tonight. This is the 5th town hall that Arapahoe County has hosted since the start of the COVID-19 pandemic. Our goal is to bring you critical information that can help keep you and your family safe, and also to answer your questions about the pandemic and resources that are available. This coming Sunday, the stay-at-home public health order for Arapahoe County will expire and will transition into what's called the safer-at-home order. This means that you are no longer ordered to stay at home, but you are strongly advised to stay at home whenever possible. It means that the virus is still present in Colorado and can resurge at any time. And for that reason, it's important that everyone understands what they need to do to help keep themselves and their loved ones safe. Safer at home means that critical businesses are still open and non-critical businesses can begin operating with restrictions. We know you have questions about this, so we have representatives from Tri-County Health, as well as county commissioners and staff on hand who will answer your questions about the Safer at Home order. They also want to share important resources with you for navigating these times. As a reminder, or if you're just now joining us, if you'd like to ask a question, you can press *3 on your phone, or you can send your question through the website. To get things started, we'd like to welcome 3 of our county commissioners. First, let's hear from Commissioner Nancy Sharp. Nancy, go ahead.
Thank you, and thanks to everyone for joining us tonight. We want to acknowledge that the last few months have been difficult on just about everyone, and we want to thank all of those who have had to make some really tough decisions. Now, however, we're transitioning to the governor's Safer at Home order, and we want to remind everyone that we still want to do as much as we can to protect ourselves, our friends and neighbors, our co-workers, and especially our first responders and healthcare workers from the spread of the coronavirus. Tonight's town hall will provide recommendations about how we can do that effectively. We're joined by 5 Arapahoe County commissioners tonight, and I'll now turn it over to Commissioner Jeff Baker.
Thank you, Commissioner Sharp, and thank you for everyone for being here. We appreciate your attending our teleconference. As we move towards opening more businesses and gradually getting our economy back on track, I just want to let everybody know how excited we are about that. As Commissioner Sharp said, we want to protect as many people as possible. This is true for folks all over the county, and especially folks that are at higher risk of getting sick. This is true even in our more remotely populated areas, because those are the places where healthcare facilities can quickly become overwhelmed should these case numbers spike again. This is why we urge everyone to continue following the practices recommended by our health experts. And I know Commissioner Nancy Jackson feels the same. Nancy?
Thank you, Commissioner Baker, and thank you to all of you that are joining us tonight. In many ways, our challenges are just beginning, particularly for those who are providing services and assistance for our most vulnerable populations. So tonight's town hall will provide valuable information about the ways to ensure that everyone stays safe and healthy as possible as we enter this new phase. We'll have Commissioners Conti and Bill Holan check in at the end of this call, but for now, I'll turn it over to the moderator. Thank you.
Thank you, Commissioners. And now we'd like to get an overview of the Safer at Home Public Health Order from Dr. John Douglas, the Executive Director of the Tri-County Health Department. Welcome, Dr. Douglas. Go ahead.
Thank you very much. It's a pleasure to be here tonight with our commissioners. This is an important moment in the trajectory of Arapahoe County and the epidemic. As you've heard, this is a long journey. We will be working together to safely go on this journey for many months to come, but I do think the ability to transition from the more restrictive stay at home so we can all stay safe and the transmission can drop and our hospitals can get prepared for a surge. Now moving to the safer at home is really a cause for cautious celebration. And I underline the cautiousness because there's still much we need to be careful about as we move into this new phase. It's been estimated that we were approximately 75% physically distanced from each other during the stay-at-home time period. That's based both on measurements of cars on highways as well as the trajectory of the disease in our community. However, it's estimated that for us to continue to make progress, keeping ourselves safe, our community safe, while our businesses begin to open, we're going to have to stick to about a 60 to 65% physical distancing. That's an average number. That's not all of us. Our older citizens or those who have underlying medical conditions such as diabetes or heart disease, those folks are urged to stay at home pretty much as they did before. As the governor's been putting it, your May really ought to look like your April. Try not to go out any more than possible. But we are going to begin to see some opening up of our non-critical retail businesses. Those have been open for curbside delivery over the past 10 days or so. And our team's been working very hard with the Colorado Department of Public Health and Environment to promote and really amplify guidelines they have for our retail and business settings. We want those vital parts of our community to get going soon, but we want them to do so safely. And we will continue to be talking about this amorphous term in some ways of social distancing. We really in some ways prefer physical distancing where we are staying apart from each other. We want to be connected socially, but we don't want to be too close. You're going to be hearing a lot about stay 6 feet apart from folks that you don't live with. You're going to be hearing a lot about masks or face coverings, the fact that they may be able to help us reduce transmission from one person to the next, we think could be a vital part of what that new environment looks like. Part of what's been achieved over the last 6 weeks and in Arapahoe County, even more so over the last 10 days or so, is improved capacity to respond to the epidemic with public health measures. You've heard a lot about the fact that we need more testing in Colorado. We still need more testing in Colorado, but I'm happy to say that our testing capacity is gradually getting better. Not as fast as I'd like, but better than it has been. For example, in Arapahoe County, the number of folks that are being tested every week has doubled over the past 2 weeks, which is a tremendous step forward because it gives us the ability to, if you're sick, help you understand that it's COVID and help you seek the proper medical care. It also helps us work with you to figure out ways of your staying in what's called isolation, preventing yourself from exposing other people to your infection while you're getting better. And then it gives us an opportunity to do something called contact notification, which is basically, I'm sick, you ask me who I've been around, you find out how to get in touch with those people, you let them know they've been exposed to somebody that's sick so they can take precautions as well. I do want to say that we are moving into this as part of a long journey. We've sort of been using that metaphor before. We are anxious to, in some ways, really balance the twin problems our societies have been dealing with, the COVID, the infectious disease problem, and the problem really with our businesses, our economies, and our jobs. Tri-County has been able over the last 10 days to put together what we think for our business partners to be a useful toolkit of ways of running businesses, frequently asked questions lists, as well as now a new email address. You don't have to call Dr. Douglas or send me an email. You can actually talk to people who can give you good advice. And I'm really appreciative of our team for getting that sort of material together to help our business community. So with that, I'll turn it back over to our moderator.
Thank you, Dr. Douglas. And now we'd like to get to some of your questions. As a reminder, you can hit star 3 on your phone at any time to talk with one of our operators. All right, we're going to go ahead and start with an online question. This is from Bruce, and this will be aimed at Melissa Saker with Tri-County Health. Bruce wants to know, our neighborhood HOA has an outdoor pool. What are the regulations going forward for opening the pool this summer?
It's a great question, and it's one that we're getting a lot. Under the Safer at Home, community pools like an HOA pool, public pools that are open to the public are not permitted to operate under this order. We do anticipate guidance from the state in the coming days regarding what kind of outdoor activities we can start to begin and what that may look like.
Wonderful. Thank you, Melissa. Let's go ahead and go to our next question. This is Barb from Aurora. She is live on the call, and this will be for Dr. Douglas. Barb, go ahead and answer your question.
Thank you. Hi, Dr. Douglas. I'd like to know, what does being a carrier mean? Will that person eventually get sick, or can they be walking around and be a carrier?
Thanks, Barb. This is we throw around terms that sometimes get confusing. What we're learning is that about 25 to 30% of people who get infected with COVID actually never get sick. And we call those individuals asymptomatic, or sometimes the term carrier is used. It looks like those people have as much virus in their respiratory secretions as somebody who does get sick actually has. And we think those individuals can infect others. At this point in time, because we are increasing our capacity to test people who are sick, but really don't have the capacity to test those that are asymptomatic, they remain undetected at this point. The good news is they're not infectious for very long, probably no more than a matter of 7 to 10 days. But they're really one of the major targets for why we are talking about these face cloths or face coverings, because these homemade masks or masks you can buy online actually will prevent transmission based on laboratory modeling studies at about a 50% level. So that's a half full glass for that person who may be infectious during that period of time, but it can substantially improve the dynamics of transmission in the community.
Wonderful. Thank you. Our next caller is Barbara from Aurora, and this will go to Cheryl Turns with Arapahoe County. Barbara, you're live. Go ahead and ask your question.
Thank you very much for taking the questions. Adams County has a rental and mortgage assistance fund. What are we doing for Arapahoe residents?
Good evening. This is Cheryl Turnus. I'm the director of the Arapahoe County Department of Human Services, and we have a one program for families, and that is called the Colorado Works Disaster Relief Program, and it has a higher gross income level. You do have to have a child, at least one child under age 18, and we will help with 1 or 2 months of rent or mortgage. And it's very easy to apply. You can go online at colorado.gov/PEAK, PEAK. There's also other funding streams available, and I would suggest that you call our Community Resources Department, the Housing Assistance Program, and that phone number is 303-738-8061. Thank you.
Wonderful. Thank you so much. Our next caller is Jan from Aurora. This question is for Dr. Douglas. Jan, you're live. Go ahead and ask your question.
Yes. Are masks going to be mandatory? And if not, why not? Because as it was just explained, when I wear one, I'm really protecting you. And I'd like you to protect me by wearing one.
So, Jan, thank you. That's a great not only a great question, but it was framed very poignantly. You're protecting me. Why shouldn't I protect you? At this point, we have not, in a meeting with our Board of Health yesterday, decided to make masks mandatory in any of our communities. Let me tell you why. We've done some recent surveys of our stores, big box stores, grocery stores, et cetera, and frankly, in some ways, to my surprise, the vast majority had high levels of folks wearing masks. Now, that's absolutely not everybody, but it was around 75% across our 3 counties. We are just about to launch a large public education campaign. Lots of people heard the Surgeon General 2 months ago say, don't wear masks. Those are for doctors, and the homemade stuff won't help you. 3 or 4 weeks ago, the Surgeon General and the Centers for Disease Control did a 180 and said, well, actually, now that the docs have more masks, as long as you don't use their mask, these can really help. They're not perfect, but they can reduce transmission. So our thinking has been, based on the currently reasonably high level of compliance, and based on the fact that we've got this campaign ready to go, we thought that voluntary approach was worth trying, monitoring to see how things improved over time. Since ultimately, mask wearing is something that we need to instill as a personal altruistic choice. I will say that city leaders in Aurora asked us to consider it, and I'm meeting with them next week to reconsider that discussion. We are the health department serving Aurora, and if there is a strong sense that that could improve situations or the use of masks in the city, Tri-County as their health department is certainly open to that conversation.
Wonderful, thank you. Now let's go to our first poll question of this evening. And you can vote by pressing that corresponding number on your telephone keypad. So the question is, for more than 7 weeks, we've been dealing with the COVID-19 crisis. And we're curious, do you personally know someone who's been affected with the virus? Press 1 if a family member has had or currently has COVID-19. Press 2 if you have a friend that has had it or currently has had it. Press 3 if a neighbor or community member you know has it. Press 4 if it's a work colleague. And press 5 if you don't know anyone that has COVID-19. All right, let's go to our online questions. We have a question from Beth. And Beth would like to know, could you please clarify the 10-person per workspace business guidelines, in particular for a private school? And that will go to Melissa Sager with Tri-County.
Hi, yes, Melissa's here. I'm sorry, my line actually cut out. Can you repeat the question?
Of course, yes. Beth would like to know, can you please clarify the 10-person per workspace business guideline, in particular for a private school?
Yes. So the 10-person limit is on all common spaces, no groups larger than 10. Schools actually have their own guidance on how to manage spaces. There is still that 10-person limit, but I'd encourage you to go to CDPHE's website to take a look at education P through 12 guidance, and it'll give specific guidance on how to keep kids safe within the school setting.
Wonderful. Thank you so much, Melissa. All right, let's go to our next live caller. This is Sarah. Sarah's from Aurora, and this question is for Dr. Douglas. Sarah, you're live. Go ahead and ask your question.
Yes, hello. Thank you for taking my question. I have a question around masks and children. There are some neighborhoods in which I see children playing together from different households with no masks. And then with my family, I have an underlying health condition, so I'm obviously trying to be very strict with our children about it. And I'm also a teacher, so I'm getting questions from my students. And so I want to know the best way to guide my students' understanding and my own personal understanding as we move to safer at home, if they'll be allowed to play together, if they stay socially distant, if they're wearing masks, and that's my question.
So, Sarah, that's a fantastic question because kids, whether they're in school or out of school, are an important part of our community and potentially an important part of transmission to other people. Basically, at this point, we would encourage families who've got kids who want to interact together to do so in a way that they can maintain social distancing. Now, that sounds like a ridiculous statement in a way if you watch kids for more than about 5 seconds. And so we encourage parents to be sort of innovative and thoughtful about what that could look like given the context of their kids and their situations. We strongly encourage kids that are old enough to kind of get it and be willing to put a cloth mask on their face to do so. It is absolutely not a substitute for social distancing, but we think it can be an adjunct, and in a case where you can't be socially distanced, we think it can be useful. Also would strongly encourage, going back to one of the very first pieces of advice we used to give, hand washing and hand hygiene. And if kids are going to do that and play together, and we can begin to train them to do regular hand washing and or carry around hand sanitizer and use it, that's an added step that can be helpful. I would note that the early observations that kids are less likely to get sick than adults came out of China. And now that the U.S. has had experience with over 1 million cases, the same observation is happening here. Kids with underlying illnesses can get sicker, but in general, the question earlier about the carrier or the person who's not very sick, that's more true with kids. And so that's why that hand washing and face cover wearing, and frankly, trying to be cautious about, are your kids playing with other kids that will obey the social distancing sort of provisos. I think those would be the core tenets of trying to manage those sort of situations.
Wonderful, thank you. Next, let's go to Rosie. Rosie's in Aurora, and this will go to Melissa Sager with Tri-County Health. Rosie, go ahead and ask your question live.
Okay, I am a senior citizen, and I need to get my hair cut and colored. I have a regular hairstylist who has come to my home in the past to help color and cut my hair when I broke my arm a year ago. I'm wondering if it would be better for me to have her come to my house or for me to go to the salon. We will be wearing masks no matter where we go, and I will probably have gloves on as well.
Rosie, thanks for the question. Your hairstylist is allowed to come to your home. There are some extra precautions that they would have to take. For instance, they would have to ask you if you've experienced any symptoms in the recent past. And they would also have to wear protective equipment. Salon stylists are asked to not enter the home to the greatest extent possible, but are permitted to do so in limited circumstances. And I think I would ask Dr. Douglas what his thoughts are regarding in person in the salon versus within your home.
And,
Wonderful, thank you.
Go
ahead.
Yeah, Rosie, I think I would add to that, you know, the salon, I don't know what the configuration of the salon is, but it's going to have other people coming in and out. And hopefully those folks will be doing what they're supposed to do in that setting, which is to wear face cloths. I would say that unless your house has lots of people coming and going, you would probably have less viral contact. If your stylist came to your house, that would in essence be one person, as opposed to you going in an environment that you might have less control over. So I think all things being considered, that might be the safer route for you.
Our next caller is Lori from Centennial, and this will go to Dr. Douglas. Lori, you're live. Go ahead and ask your question.
Thank you. I'm 80 years old. I live by myself, and my children are out of state and are, of course, older. And I've been advised by a UPS that I'm expecting flowers tomorrow, and the origin is Bogota, Colombia, that these flowers are coming from. Is there any danger to me for having these flowers delivered and being in my home?
Well, first of all, let me say in advance, Happy Mother's Day. I'm glad your kids are remembering you, even though they can't be with you. I think the risk of those being in your home is really quite low. There's not really been any evidence that we've got transmission from floral products like that. I think as maybe a minor precaution, once they're delivered, I might put them in a vase or however you're going to display them and sort of set them to the side, wash your hands, just to be sure whoever is delivering them, could have potentially contaminated their own hands. And if they are left to the side on a surface without your contacting them for a couple of hours, I think you should have no worries.
Great, thank you, Doctor. And now let's go to Lisa. She's in Greenwood Village, and her question will be for Melissa Sager. Lisa, go ahead.
Hi, I'm wondering about youth sports. How does this work, the safer at home? Are youth sports allowed? And if so, how soon can the kids start practicing?
Yeah, that's a really great question. Thanks for that. We're hearing that a lot. We know that a lot of our youth and parents want to get youth back on the field for exercise and socialization. Team sports activities are prohibited. We are looking at what it looks like in a personal training setting. So in those small groups of 4 to allow kids to start getting back on the field and working on skills and activities and exercising in that way. We do expect further guidance from the state health department regarding, again, I mentioned this before, but a lot of outdoor activities. So these activities are a little riskier because you have close contact, especially in sports like soccer, but even baseball where you're sharing equipment, maybe touching the ball that someone else has touched. And so we're really focusing on how we can keep kids safe while letting them engage in this activity. And it may look like just having these activities in bigger spaces with no contact, but we're exploring that and we'll hopefully have guidance in the near future.
All right, let's go to our next poll question. Again, you can vote on your telephone keypad, and the question is, we know everyone is anxious to get back to visiting their favorite restaurant, so we'd like to know this. Have you gotten takeout from an Arapahoe County restaurant during this crisis? Press 1 for yes, and press 2 for no. And as a reminder, pickup and carryout are still available at most restaurants. So now let's go back to some more questions. We have Mel, and she has a question for Cheryl Turns. Mel in Greenwood Village, you are live. Go ahead and ask your question.
It's to any of the Arapahoe County Commissioners. I'm 85 years of age. When I call in, does Arapahoe County have a division that deals with the problems of the elderly? And when I call in, what do I ask, or how do I access that particular division?
Mel, I would advise you to call 303-636-1170. That's the Department of Human Services main number, and ask to speak to someone about aging and adult services. We do have programs, financial assistance, there's food assistance, and also we provide some home and community-based services. Again, if you will give us a call, 303-636-1170, and ask for to speak to someone regarding aging or adult services. Thank you.
Our next question is Bert. Bert is in Centennial, and their question is for Melissa Sager with Tri-County Health. Bert, you're live. Go ahead and ask your question.
Okay, yes. My question is whether an indoor, a business that operates an indoor athletics facility could offer during Safer at Home limited one-on-one private lessons or instructions if 4 or fewer persons are participating in that instruction at any one time, and they follow all of the guidelines required in terms of mask wearing, sanitizing high-touch areas, and so forth.
It's a great question, and honestly, it sounds like you know the order just as well as I do, because those are the requirements. 4 or less, small group settings, yes, these workout facilities can operate in that way. It has to be by appointment only, and it can't be open to the public. But yes, as long as you're following those guidelines, that's permissible.
Thank you. Next, we have Fred in Aurora. His question is for Dr. Douglas. Fred, you're live. Go ahead.
Yes, hello. We ordered new windows for our house a couple months ago, and they've been in the warehouse for about 6 weeks now. Would you think it's safe to install 21 new windows in our house during this crisis?
Fred, I want to be sure I got your question. You've got some new windows that have been in a warehouse, and you want to know if it's safe to install them. Did I get that right?
Yes, sir.
Yeah, I don't know of any reason. There has been concern. Frankly, I think maybe in some ways a little too much concern about the transmission by inanimate objects. I assume that maybe what your concern is the windows. Could somebody have touched them, and you would potentially be at risk in terms of contact with them. I think if they've been not touched by anybody for really over a day, there wouldn't be any risk to you for handling them and doing the carpentry you would need to install them. So if I follow the scenario correctly, I think you ought to be in good shape.
Wonderful. And again, we are about halfway through our telephone town hall discussion this evening about the transition to a safer at home public health order. We've had some great questions, and we have a lot more lined up. Again, if you'd like to ask a question, you can press *3 on your phone to speak with an operator. Next, we have Janet. Janet's in Aurora, and this question will be for Melissa Sager with Tri-County Health. Janet, go ahead.
Yes, I'm an elderly person, and I'm a person of extreme illness, and I need someone in my home to clean my house. And I had someone coming to do that, but when the stay-at-home order went into effect, I didn't have anyone coming. And now I'm wondering if it's possible to have that person come back to my home. I realize that it's risky from the standpoint of the fact that she will be going to other people's homes as well. But what kind of guidelines can you give me if she is allowed to come? I don't know whether that is considered a business that's allowed even. Can you answer that for me?
I can. That's a great question. Thank you for it. Yes, home cleaning is allowed under the Safer at Home. These businesses are considered field services, and that being they come out into the field to provide their services. There are strict guidelines for these services under the Safer at Home order. Some of them you've heard. They should keep 6-foot distance. They should not have more than 10 people in a space at a time. They should be wearing a mask when they come into your home. And they'll keep a log of who they've had contact with, which would include you as well as them. And they're allowed to provide those services as long as they're adhering to those requirements. And we do understand that folks in your situation, that's a service that's needed. And so it is allowable under this. And we just ask that you and the person who comes to your house just stay safe and adhere to these social distancing guidelines.
And if you're looking for more information on the Safer at Home order, we can direct you to the Tri-County Health Department's website. There you can find lots of information about COVID-19, as well as resources to help keep you and your family safe. You can visit their website at www.tchd.org. Our next live caller is Wayne. He's in Centennial. This question is for Dr. Douglas. Wayne, you're live. You can go ahead and ask your question.
Hey, good evening. Yeah, this is Wayne. I'm a retired guy from Arapahoe County. But anyway, I've been home since mid-December, haven't left because I broke my foot and it's not healing, so I'm just hobbling around the house. But I feel good. But I had a question. I also have rheumatoid arthritis, and I take a whole bunch of chemotherapy, leflunomide and methotrexate, plus a steroid, prednisone. Does that, I heard on the news, does that help kill the virus bug? And also, does flushing your sinuses with warm salt water help, or does it kill off the bug? Thank you.
Wayne, hi. Sorry about your medical problems. You've really gone through it. The meds you described, the chemo, steroids, and methotrexate, they're not going to help you with the virus. There is interest in using immunosuppressant drugs in really sick people in the hospital in combination with an antiviral drug, because the immune response in some cases seems to make the disease worse. But I don't think you could bank on any value from that. And in fact, if anything, as you probably know, those drugs will suppress your immune system. So you're in the category of somebody who needs to be quite careful. There's been a lot of thinking about what we could do vis-a-vis direct material in the nasopharynx or the mucosa to try to reduce viral shedding or to protect ourselves. A lot of theories out there. I haven't seen anything. I don't. So if sinus lavage is something you have found useful because you have chronic sinusitis, for example, I think there's no reason not to do it, but I wouldn't expect it to give you antiviral assistance.
Thank you, Dr. Douglas. And we have another question for you, Doctor, as well. This is from Jeannie in Aurora. Jeannie, you're live. You can go ahead and ask your question.
Hello. Thank you for taking my question. My concern is that my daughter, who's an adult and married, is interested in leaving next week for a road trip to go to Washington State to visit friends out there. And, of course, I'm going to let her make up her mind as to what she does, but my concern is she putting herself at risk by doing that and going cross-country by car?
Sure. And your daughter lives in Aurora, I assume, or lives in Colorado?
She's in Aurora also, yes.
Yeah. Well, I guess I'd say a couple of things. First of all, the governor has asked all of us to stay at home as much as possible and has even said his definition of that is no more than 10 miles from home. So, there is that gray area that she'd be, if you will, out of compliance with that order. Practically, obviously, there are some folks that make that choice and make that decision. Washington actually has less transmission going on right now than Colorado does. And the states through which she might be driving, depending on the route she took, probably also have less transmission than Colorado. So while I would tell anyone who's going to go out to follow the precautions we've talked about, hand washing, social distancing, face masking, and certainly depending on who she's staying with in Washington when she's there, follow those precautions as well. If she's camping, staying by herself, that's probably better. So, getting out and about is going to entail some risk for anybody. Presuming she's reasonably healthy, we would officially say, hey, stay at home. If she's headstrong and wants to take the trip, those are the precautions I think she should take.
All right, let's go to our next question. Dean in Centennial, and this question is for Kelly Folks with Arapahoe County. Dean, you're live. Go ahead and ask your question.
Hi, can you hear me?
Yes.
Yes. For those of us who became unemployed because of this pandemic, one of the great resources is the workforce centers, and I was wondering if there's any discussion of when those will be open.
Yes, Dean, thank you. This is Kelly Folks with the Workforce Center. Many of the workforce centers in the metro area are working towards creating social distancing and safer modifications within the career resource centers. Therefore, most of them are looking to open by June 1st for in-person services again. Some may open sooner, as early as May 18th or the week of May 18th. What I would suggest right now between that time frame is there are virtual services available. Every service that normally would be available in person is also still available, especially through Arapahoe Douglas Works virtually right now. So I would suggest going to www.adworks.org, or you can call our call center at 303-636-1160, and you can set up a one-on-one appointment for further assistance in the meantime until we are reopened to the public. Thank you.
All right. Thank you very much for that. And now let's go to Barb. Barb is in Aurora. And this will go to Melissa Sager with Tri-County Health. Barb, you're live. Go ahead and ask your question.
Sure, thanks. Hi, Melissa. My question is about the reopening of places of worship. I'm at a very big parish here in Aurora, and I understand that when we start having masses again, we can only have 10 people in a space. And somebody said there's really not a dimension for what a space is. So we have a very large family hall and a very large gym that we could, figure out a way to get maybe 60, 70, 80 people in there and have everybody, separated by 6 feet or whatever. And I found out that we can still only have mass for 10 people at any one time. And that to me sounds a little bit unreasonable. So can you elaborate on that a little bit?
Absolutely. And we understand the frustration as we navigate this with places of worship and the setting issue. You're absolutely right. That definition of what a setting is. So if you have a large enough facility, could you put 20 people in one room? Right now, the strict interpretation of the order is no, and that means 10 people in a single location. There are additional concerns besides the 6-foot distancing that include shared spaces like restrooms. We've talked about staggering services so that people aren't coming in and out of the door at the same time. And so even if you could fit that many folks into one space, there are still some other things to think about. We are actively having these conversations internally as well as externally with the state, and we anticipate guidance soon about what that can look like. But right now, as we ease gradually into the reopening, we ask that churches keep that limited to 10 until we see what the safer at home looks like as we ease into that and what more we can do to keep folks safe while letting them congregate.
Okay, our next question is Joan in Inglewood. Her question is for Dr. Douglas. Joan, you're live. Go ahead and ask your question.
Hi, I just heard lately that that you can catch the virus more than once. I was wondering if that's true.
So that's a really excellent question and one on a lot of people's minds, especially as more people have actually had COVID. The answer is honestly, we don't know. There have been a series of well-publicized series a couple of weeks ago of individuals in South Korea who had recovered. South Korea has had more fortunate experience with the virus than we have, who then, when tested again, had positive results. Some of the ones who were tested again were sick. Others were simply in environments where they could have been exposed to it. We don't really know whether that represents second infection, potentially people who never really cleared their first infection, or even the idea of a false positive test. We know no laboratory tests are perfect, and certainly the ones we're using for COVID. There's a huge amount of interest in determining whether when we get sick, if we make antibody that are being tested for now, those will sufficiently protect us. The experience from many coronaviruses that cause common colds, because, by the way, coronaviruses have been around for a long time, have been that there is often short-lived immunity, but it may not last more than 3 to 4 months. In contrast, the experience to the first SARS virus 20 years ago was that immunity seemed to be longer lasting. So I think, in all honesty, the question's unanswered. We'd like to hope, and certainly based on other examples, there's reason to believe we'd have at least short-term immunity, but how long it will last and whether everybody who gets sick gets immune isn't clear yet.
Thank you, Doctor. And now let's go to Harold. Harold is in Aurora. Harold's question is for Melissa Sager. Harold, go ahead and ask your question.
Doctor?
Harold,
Hello?
go ahead.
Yes?
You can
Hello?
ask your question live now.
Hello?
Can you hear us, Harold?
No, I can't.
Okay, I see your question. I'll go ahead and ask it for you.
Okay.
All right. Harold would like to know, where can he obtain a face mask? And that question is for Melissa Sager with Tri-County Health.
I'm actually going to turn that over to Dr. Douglas.
Sure.
Harold, there are a lot of places now where one can get this. We've got some information listed on our health department website. One in particular is called the Colorado Mask Project, which has sort of ended up being a clearinghouse of where can you buy masks, where can you order masks, are there organizations that are making masks and providing them to be donated to other people. So those are easy resources. Frankly, there are a lot of places online. I don't know whether you are comfortable or used to shopping online and this kind of thing, but lots of, if you simply Google face masks, you'll come up with millions, not millions, but lots and lots of options there. So, and then finally, just to be clear, there are instructions on lots of places, including our website, for how to make your own. And you don't have to be an expert seamstress to make a mask. You can actually take an old T-shirt and cut it up and come up with a reasonable facsimile of something that will give you some protection. So I think those would be useful sources to consider.
Great. And this next question is for you as well, Doctor. This is Janet in Aurora. Janet, go ahead and ask your question live. Janet, are you there?
I'm sorry, yes. Yes, my
you can
question...
go ahead and ask your question live.
Thank you. I was wondering if, and maybe this has been covered, but I have not heard it, if our mail and the newspaper, are they safe? I always wash my hands after reading my mail or newspaper, but I know on cardboard they say it can last 3 days. So I didn't know how to handle mail and newspaper in the bag that the newspaper comes in.
So that's like a really important practical question that we don't really have like laboratory-based evidence for. But what I would say is the following. There's a small chance that if a mail deliverer or a newspaper delivery person had COVID on their hands, they could have left it on there. I think it's probably safest with either one of those is to handle them, discard them whenever you're not ready to need them anymore. Most of my mail is junk mail, for example. For those things that you are going to keep, including your newspaper that you want to read, I think washing your hands after you use it, and if you put it down on a surface, a kitchen counter, something like that, is to clean it afterwards. Again, as I sort of alluded to earlier, I don't want to be overly minimalistic about concern about these inanimate objects, but I do think that some pretty straightforward precautions is enough to protect you. I think the risk they present is really quite low.
Thank you, Doctor. Now let's go to Jean in Aurora. This question is for Melissa Sager with Tri-County. Jean, you're live. Go ahead and ask your question.
Yes. We are active senior adults, and we would like to know when the public tennis courts are going to open. We've driven around and seen that private courts are open, and it just seems like we could have lots of social distance on the tennis court, and as well as get some exercise and good mental health.
Great point. tennis courts are allowed to operate under the Safer at Home. We see that our parks and public courses like that are taking their time to reopen and doing so with proper signage and information for folks using those facilities. And so that's probably coming in the near future. I'll just add that you should not be sharing equipment. It should be small groups and preferably with someone from your own household.
Thank you, Melissa. And this next question is for you as well. Lynn in Centennial. You are live. Lynn, go ahead and ask your question.
Hi there. I was calling about orthodontic offices and specifically who it is that determines whether they're essential or non-essential medical and whether they should be open. I don't know if that comes through DORA or Tri-County Health. A particular office in Douglas County that I know somebody working there is open and has been for a couple of weeks. And due to limited supplies, they're providing their employees with one level 1 mask per week. They are taking some extra precautions with cleaning and different things like that, taking temperatures of patients and anybody else coming into the office. Their full staff of 13 is working, and I'm just wondering if that's appropriate. And if not, if you may know how unemployment benefits might be affected for an employee that's not comfortable working at that location.
Yeah, it's a great question, and I'm sorry to hear that someone may not be operating safely. I'll say first that we are responding on a complaint basis. And so if a business facility is not operating up to a standard that keeps patients and employees safe, we want to hear about that at Tri-County. The phone number to contact is 303-220-9200, and we'll have folks reach out to that specific business. Dentistry in general is allowed under the Safer at Home. The order is, while it's separate from the Safer at Home, these elective medical procedures are actually regulated under a separate order that allows these procedures to continue. Under the order, these facilities are asked to, while they're allowed to provide services, if a service can be put off, we're still asking these providers to do that. Again, shortage of equipment, keeping people home to the greatest extent possible. But even regular procedures that may have been put off for a long time can begin to happen. It's based on your provider. So we ask patients to reach out to their provider to determine whether a procedure is necessary. These facilities are permitted to operate so long as they're adhering to social distancing and personal protective equipment requirements, but they need to be able to adhere to all of those requirements. And so if they're not doing so, we want to hear about that. And I'd encourage you to reach out.
All right, let's go to Brent in Centennial with a question for Dr. Douglas. Brent, you're live. Go ahead and ask your question. I think we might have just lost Brent. All right, I think he's gone for a minute. Okay, let's go to our next caller. We have John in Littleton. John has a question for Melissa Sager. John, go ahead and ask your question. You're live.
Yes, I was calling first. I got to say, myself and our 5 children love the parks, and my question along the path. And my question was, are you looking at? And maybe I missed this. Are you looking at opening them up soon, or a way to sanitize them during the COVID issues?
This is playground equipment that you're talking about.
Yes, ma'am.
Yeah, so playground equipment is a bit concerning. The high-touch surfaces, very hard for kiddos to keep social distance playing on this equipment, and it's hard to articulate to children that they need to stay 6 feet apart when operating on this equipment. So that is the hesitation in opening them right now. like other outdoor activity, we are talking about what this activity could look like as we move forward. It's just something that we have to be a bit more cautious about. Again, the surfaces and close contact that's hard to avoid in those settings.
Great, thank you. And now we have a Facebook question. This is for Glenn Poole in Open Spaces, and they would like to know, are Arapahoe County trails open at this time? Glenn, go ahead.
Good evening. Thanks for the question. Yes, our Arapahoe County trails are open for public use. We do encourage visitors and users of our trails to maintain their social distancing while they're enjoying our trails, and also comply with hand washing and sanitizing once you're home. If you touch any of our signage or pull waste bags from our dog containers or touch any trash cans when you're in these public spaces. But please enjoy our trails. They are open to the public.
Wonderful. Thank you, Glenn. Let's go to Erin in Littleton. She has a question for Dr. Douglas. Erin, you're live. Go ahead.
Hi, thank you for doing these town halls. They're very informative. My question is when restaurants will open for dine-in and restaurants and bars will open for dine-in.
Sorry, is that for me, moderator? Or?
Yes, go ahead, Doctor, if you think that's
I'll take a stab,
safe or not.
I'll quickly kick it over to Melissa, who's our expert. The answer is we don't know. There is active consideration of your question, because I think we all realize that there's been severe economic stress on them, and frankly, it's an important part of society. Considerations are including things like what sort of physical constraints need to be inside the restaurants, what sort of spacing needs to exist. I don't know the timing of that, but I do know it's an active topic of consideration at this point. Melissa, anything to add to that?
I'll just add that the governor has a task force in place of stakeholders in the business industry, including restaurants, actively discussing what this can and should look like to ensure safety. But otherwise, nope, that was it.
Okay, next let's go to an online question. This is for Dr. Douglas. Is it safe to go to an urgent care office?
So thanks for that question, because it's one we probably should have highlighted before. It's absolutely safe to go to an urgent care office or an emergency room or your doctor's office or a hospital. Those are places that we think have been underused by the public in the last 6 weeks. Part of it was due to messaging about if you have COVID and you're sick, stay home because we can't test you. Part of it was, frankly, I think understandable but misplaced fear that hospitals were COVID-filled places that you'd get sick if you would go. Consequently, we've seen concerns that people with other health issues not getting adequate health care. And our hospitals are ready, willing, and able to serve our public, as are our urgent care centers. So if you've got an issue that needs to be addressed, by all means, I think you should feel free to go. The one caveat is if you have what could be COVID illness, cough, fever, chills, shortness of breath, call them before you go, because they may not all urgent care centers do testing, and if they do testing, they may have some guidelines for where you should come in the building and this kind of thing, so they can handle you safely.
All right, we have another question for you, Dr. Douglas. This is Carla in Arapahoe County. Carla, go ahead and ask your question.
Hi, doctor. Is it safe to go to nail salons where they do manicures and pedicures?
So nail salons were among the businesses that were not considered critical and therefore not open under stay at home. They will be opening in Arapahoe County along with other personal services businesses on Saturday. And as long as they follow the strict precautions of the kind that Melissa talked about earlier, vis-a-vis hair salons, meaning that they ought to have a limited number of people in the facility, the people providing the services ought to be wearing a mask, and the people going to receive the services ought to wear a mask as well, that you will be able to go to those with some degree of confidence. Now, I say that sort of caveat, some degree of confidence, because part of the governor's proviso is that if you're older or if you have underlying illnesses, be careful when you go out. Go out when it's essential, and that's a judgment each person would have to make about whether this service would be essential for you. But they are going to be opening with those strict precautions in place.
Great, thank you. Our next question is an online question from Robert, and this will be for Melissa. Is there guidance for home health massage therapy?
Yes. So massage therapy is allowed under the order, under Safer at Home. It would be very similar to the guidance for field services that I provided earlier, but it is wearing a mask, checking for symptoms of both yourself and your customer when you go, making sure that you're logging that, and wearing a mask, both the customer and the provider who's doing massage therapy. But otherwise, that is permissible as long as everyone is adhering to the social distancing guidelines.
Great, thank you. Next, we have Heather. Heather's in Aurora. Her question is for Dr. Douglas. Heather, you're live. Go ahead and ask your question.
Hi, I'm a parent and teacher, and I know that kids are less likely to suffer from coronavirus. But right now, for over 50 days, there's been no playground, sports, gymnastics, dance, karate. And I know I keep hearing about the physical distancing, the social distancing for their physical health. But these activities also bring them physical health, and we're talking about getting it back going, but these things have been shut down for 50 days already. Is anybody considering the mental and emotional health, not only the physical health they're losing, but the mental and emotional health? I know kids who are crashing weekly because everything they love and use has been taken away from them. So while you're thinking about it, these kids are hurting mentally and emotionally, and I never hear anybody address that. So I was just wondering, thoughts on that?
So this is Dr. Douglas. A hugely important issue. It's not in the news as much, but it's absolutely being considered. We are hearing reports of our mental health crisis lines receiving increased numbers of calls. Everything you've said, honestly, Heather, is completely clear and people get it. That's why the sort of issues about youth sports and playgrounds are being so actively looked at. So shame on us, if you will, as public officials that we haven't made that balancing act and those balancing considerations more clear, because we really get it. And we as public health officials actually are not just around to take care of infectious diseases. Actually, one of our biggest focus areas in the Tri-County region until the COVID epidemic came was mental health. It's been a topic of our public health improvement plan. We're still deeply interested and worried about it. So thank you for that passionate reminder that health exists in many dimensions, and we're certainly considering that as we consider the examples, playgrounds, sports, et cetera, that you mentioned.
All right, our next question is an online question from Sarah, and it's directed towards Melissa Sager with Tri-County. When will child care centers be able to open fully?
So child care centers are permitted to operate under the order. Under the stay-at-home order, child care centers were asked to limit their clients to essential workers. Now they're open to all workers. We do still ask that those child care centers operate in a safe way under these circumstances, and that includes stable groups of 10 children or less. So kids that stay in the same group of kids with the same instructor in one room, and that is to keep kiddos under that 10-person limit to decrease the risk of spread. And so these facilities are permitted to open, and we're looking at ways to support them in every way we can, but we're going to keep those precautions in place to make sure they're operating safely.
Wonderful, thank you. Let's go to Susanna in Aurora for Dr. Douglas. Susanna, you're live. Go ahead and ask your question.
Thank you. My question is regarding clothing. Assuming that retail stores open and you're trying on clothes and then you put them down and somebody else tries them on, or in my case, I process compression garments that are returns, and I'm handling garments that have been worn by people previously. What are the risk factors with handling clothing garments that have been tried on or touched or managed by people who could conceivably be carriers?
So, boy, that's a really interesting question, not one that I've previously thought through, although it's an important question. I don't know of any data that talks about the duration of virus on clothing, which is really kind of the question you'd be getting at. I think what I would say about that is certainly if you're handling clothing that's been worn or touched by other people, I'd be really careful with hand washing and hand sanitizer. Now, the typical clothing store doesn't have lots of hand washing facilities. I think that'd be a great place for having hand sanitizer with you. If you were handling material that's being shipped back or brought back or whatever, I'd say the same thing. And then I guess I'd have to ask, I'm not actually honestly sure what manufacturers are doing or retailers are doing with clothing that's been brought back. I don't think it's likely to be a major issue, but Melissa, I don't know whether you've seen anything that addresses that concern because I'm sort of winging it and I'm not sure I've got the best answer for Susanna.
There is a restriction for retailers to only accept items that can be properly sanitized before reselling. So some retailers have restricted returns. Many retailers are not taking returns right now. But I think this does speak to the amount of time that the virus could live on fabric. And so if you could reach out to us directly, I'd love to provide more information once we can determine the data that's available on that specifically.
Okay, great. Let's go to Marilyn in Centennial. This question is for Dr. Douglas. Marilyn, go ahead.
Hi, thank you for taking my question and thank you for what you do. I'm 67 years old and I'm just wondering if it's safe to do your annual well visits and like annual mammograms, appointments like that.
Thanks. A really good question, and those are the kind of things we absolutely do want to encourage people to do. We talked a lot about during the stay-at-home time period about elective procedures or elective healthcare visits being postponed. We certainly don't, over the long haul, think of things as mammograms or blood pressure checks or this sort of thing as being like optional. They're important. And now that we're back in a more open time period and our healthcare providers are opening up, as we discussed previously, it's not only fine for you to go in, I would encourage you, especially if you're running the risk of getting behind on regular checkups.
Thank you, Doctor. And we have another question for you from Siobhan in Aurora. Siobhan, go ahead and ask Dr. Douglas your question.
Hi, I just want to say thank you guys for taking my question and thank you for doing this call this evening. My question has to do with schools. It's a lot of parents of us that school's been canceled for the entire year. So now we're at a point where we're still trying to wonder if school's going to come back next year or if there's going to be any type of summer programs. And is that even something that we think we should even be looking forward to going back to school? Because I don't know how they can safely, like my daughter had 25 in her class, how that would work or what's going to happen with schools, I guess, or if you know anything.
Well, I don't know that much, but I know a little because I've been talking to the superintendents across the counties, including those at rural public schools, and it's like hugely on their mind right now. I think it is unlikely that summer programs are going to be able to come back, although even that's not been firmly decided. There is intense discussion about what programs could look like in August or the fall when schools start back again. Denver Public Schools just announced that they were going to be exploring a hybrid approach where some kids were there and some kids were doing remote learning. They haven't figured out what that would look like exactly. I know that Superintendent Munn in Aurora Public Schools, as well as other superintendents, has got that on the table as a possible option. In fact, they've asked us as public health to give them, like, what are the guidelines they need to follow to get back. So I think there is recognition that what's happened to our kids has been perhaps necessary, and I think it was extraordinarily helpful in curbing transmission, but we don't want that to go on in the fall. So they're really working quite hard to figure out what those strategies look like.
Thank you, Doctor. Next, let's go to Donna in Centennial, and this will go to Kelly Folks with Arapahoe County. Donna, you're live. Go ahead and ask your question.
Thank you for taking my call. I'm on unemployment, and I have been unable to get through to ask a question. I am curious on how taking a withdrawal from my 401k account, a loan may affect my unemployment.
Yes, Donna. Hi, this is Kelly. It typically will affect your unemployment in that it could cause you a delay in receiving future payments because it is countable income. So my suggestion would be if you can't get a hold of unemployment, please do feel free to call our call center. That's 303-636-1160. And our staff are able to chat with the UI through a secured UI chat line. And so they may be able to help you and get some further information for you and get you what you need moving forward. So I would suggest calling again that number 303-636-1160 and speak with our call center, and they'll be able to help you get a hold of a UI, hopefully.
Okay, thank you so much.
Okay, next we have Travis in Aurora. His question is for Dr. Douglas. Travis, go ahead and ask your question.
Hi, Dr. Douglas. Thank you so much for taking my call. So my fiance and I have a wedding ceremony planned with around 60 people in late June, and there's people traveling in, so we're kind of wondering if it's prudent for us to cancel right now.
I'm going to give you a quick reaction, see if Melissa can add anything, because we're going to, as you can tell, we're tagging this. Right now, that 60 people situation would be in excess of the 10-person public gathering. We've been interacting with the State Health Department on a regular basis about when they think the governor will decide what's going to happen after the May 27th current time frame for the Safer at Home order. What we're hearing, Travis, honestly, is it really depends on what's happening in the community, what's happening with viral transmission, which is why people like me are pushing so hard to get all of us to take this as seriously as we can. The more we're all in it together, including the wearing of the face coverings, the less transmission they're going to be. I think it's really honestly up in the air. If it was my wedding, I'd want to be thinking hard about whether people were going to be having non-refundable expenses, plane flights, whatnot, because I think it's honestly just hard to predict where we're going to be at that point in time.
Great. Thank you, Doctor. And we have time for one more question this evening. It'll be from Cindy in Centennial for Dr. Douglas. Cindy, go ahead and ask your question.
Hi, Dr. Douglas. Does safer at home mean that we should continue to not see our grandchildren if we're in that older age group, or can we now have them over and babysit, or what would you recommend?
Well, I have grandchildren too, and my wife's asking me that question, so it's a very personal one for me. I would say right now we have to be careful about that. We've gotten asked so many questions like this about personal gatherings that we're trying to come up with some practical tips for how you can interact with your family. I think part of the answer depends on how old your grandkids are and whether they, can socially distance from you. You don't want to socially distance from them. You want to give them a hug. I know that. But I think depending on where they've been, if they've had contact with other people, kids are the most likely to be asymptomatically infected and to potentially infect you. So I think I would suggest that you cautiously consider interactive settings. Outdoors, for example, would be good. Try to avoid the temptation to give them a hug. Wear a face covering, and if they're old enough, my 2-year-old won't, but your grandkids may be older, that's a useful tip as well. And lots of hand washing for everybody. And honestly, just be careful, because the emotional pain of not being able to hug your grandkids is clearly an issue. And those of us who've got those kids and we're old enough to be concerned have got to try to balance those things together.
Wonderful. Thank you. We have enjoyed this time with you tonight, and we hope that you have found it useful. Commissioner Kathleen Conti will now offer the last word before we sign off. Commissioner? Kathleen, are you there?
So sorry, trying to get to unmute. My apologies.
No worries.
Yes, I just wanted to thank everyone for taking the time to tune in tonight. Obviously, much great information has been given, and we do appreciate your patience as we have gone through this, everyone doing their small part. And I know it's been very difficult emotionally, physically, economically for so many. And I pray for all of us that there is light at the end of the tunnel, and that we can all get back together soon. And I know that that is the hope of so many of our officials. But thank you for being with us tonight and taking the time to get a little bit more educated on what we can all do to make it easier.
Thank you, Commissioner, and thank you all for joining us. Be well. As a reminder, we'll post a copy of this recording to our website in the next 24 hours. Have a great evening.